According to Kidney.org, each year, more than 500,000 people go to emergency rooms because of kidney stone problems. Well, it's not a new issue as mankind has been dealing with urinary stones for centuries, dating back to 400 BCE. But it's still a common and painful condition that can affect anyone at any age. Kidney stones are also associated with an increased chance of chronic kidney diseases, cardiovascular diseases, diabetes, and hypertension, so just imagine how important it is to know about their symptoms. In this video, I'm going to walk you through the top 5 kidney stone symptoms that you should know about to keep your kidneys healthy and pain-free. What is a kidney stone? But first, let's understand what exactly kidney stones are. Kidney stones, also known as renal calculi, are solid masses or crystals that form from substances like minerals, acids, and salts in your kidneys. They can be as tiny as a grain of sand or, in rare cases, as large as a golf ball. There are 4 main types of kidney stones, which are calcium oxalate, uric acid, struvite, and cysteine. These stones can form in any part of the urinary tract, including the kidneys, ureters, bladder, or urethra. Now I know what you're thinking, how do these tiny crystals cause so much pain? Well, when there is an excess amount of waste products in your urine and not enough liquid to dilute them, these crystals start sticking together to form a solid mass. And this is when the trouble begins, as they can get trapped in your urinary tract and cause extreme pain, discomfort, and other serious complications. I think it's enough with the technical details, so let's dive into the top 5 symptoms of kidney stones that you should never ignore. Severe pain in your lower back, belly, or side. The most common symptom of kidney stones is pain that radiates through your lower back, belly, or side. You may feel a dull ache or sharp, intense pain that comes in waves. This type of pain is often described as colicky because it can get worse in waves and then subside for a short period before returning. This happens when the stone moves down the ureter and gets stuck, causing a blockage in the flow of urine. But why does this pain occur? Well, when the stone starts moving through your urinary tract, it can cause irritation and inflammation of the tissues lining your kidneys and ureters. This leads to intense pain that may be felt in the flank, side, or abdomen area. In some cases, the pain can be so severe that it may spread to your groin and genital area, causing discomfort in the testicles or labia. This type of pain is often described as one of the most severe pains a person can experience, even compared to childbirth or a heart attack. It can make it difficult to move, sit, or even stand still. Even small kidney stones can cause this type of pain, so don't underestimate the size of a stone. If you experience sudden and severe pain in your lower back, belly, or side, it's essential to seek medical attention immediately. Also, try to avoid any movements or activities that can worsen the pain. While, in most cases, the pain will subside after the stone has passed or been removed, it's always better to consult a healthcare professional for proper treatment and prevention of future kidney stones. So, don't ignore this symptom. Seek help as soon as possible to avoid further complications. Nausea or vomiting. Another common symptom that many people with kidney stones experience is nausea and vomiting. It's not a pleasant feeling to have, and it can happen along with or without pain. But why does this happen? Well, it's because our kidneys and GI tract have shared nerve connections, which means any disturbance in one can affect the other. When a kidney stone is present, it can irritate these nerves and send signals to your brain, causing an upset stomach. This reaction can also be your body's response to intense pain, as nausea and vomiting act as a defense mechanism to get rid of anything that might be harmful. But it's important not to brush off these symptoms as just an upset stomach. Nausea and vomiting can cause dehydration, which can further complicate kidney stone treatment. It can also lead to electrolyte imbalances, causing weakness and fatigue. While these symptoms can also be caused by other conditions, such as migraines, food poisoning, intestinal obstruction, or ulcers, it's always better to consult a doctor if you experience them along with other kidney stone symptoms. A healthcare professional can help determine the root cause and provide appropriate treatment, such as anti-nausea medication or fluids to prevent dehydration. These treatments can also help manage pain and discomfort caused by kidney stones, at least until they are passed or removed. Pain or burning during urination. Dysuria, or, in simple terms, pain or burning during urination, is another common symptom of kidney stones. This happens when the stone reaches the junction between your ureter and bladder. The feeling can be described as sharp, intense, or burning and can occur in both men and women. It's easy to mistake this pain for a urinary tract infection, especially if you're not aware of the presence of a kidney stone. In some cases, you may also experience a UTI along with the stone, which can make the pain even worse. Another related symptom is urinary urgency, which means feeling a sudden and urgent need to urinate. This can happen as the stone moves into the lower part of your urinary tract and irritates the bladder. Urinary urgency can also mimic a UTI symptom, but it's important not to ignore it as it may be an indication of a kidney stone. Similarly, if you notice that your urine flow has become slower or stopped entirely, it could mean that the stone is blocking the passage of urine. This blockage can cause significant discomfort and even lead to a medical emergency if the flow of urine is completely stopped. So, if you experience any pain, burning, or changes in your urination pattern, it's essential to consult a healthcare professional for proper diagnosis and treatment. If you don't want to end up with a UTI or risk further complications, don't ignore these symptoms and seek help as soon as possible to ensure your well-being. Cloudy or smelly urine. The number 4 symptom that may indicate the presence of a kidney stone is cloudy or smelly urine. Generally, healthy urine should be clear and odorless because it primarily consists of water and waste products. However, if you notice a change in the appearance or smell of your urine, it could be an indication of an infection in your urinary tract or kidneys. According to a 2021 study, about 16% of people with acute kidney stones also experienced a urinary tract infection. Cloudiness in urine can be a sign of pus or pyuria, while a strong odor may come from the bacteria causing the infection. It can also be a result of urine that is more concentrated than usual. Blood in the urine, also known as hematuria, is also a possible symptom of kidney stones. The urine may appear red, pink, or brown depending on the amount of blood present. Sometimes, the blood cells are too small to be seen with the naked eye, which is known as microscopic hematuria, and can only be detected through a urine test. If you notice an abnormal color or smell in your urine, it's crucial to take this symptom seriously and consider it a red flag. Don't dismiss it as a temporary change, and seek medical attention to rule out any underlying issues that could be causing it. Fever or chills. The 5th symptom that should not be ignored when it comes to kidney stones is fever and chills. While these symptoms are more commonly associated with infections, they can also occur due to a kidney stone. Fever is a sign that your body is fighting off some form of illness, and it occurs when your body temperature rises above the normal range. In the case of kidney stones, a fever may occur due to an infection in your kidneys or urinary tract. This can be a serious complication and requires immediate medical attention. Chills are often accompanied by a fever and refer to the feeling of being cold without an apparent cause. It happens when your muscles repeatedly expand and contract, causing you to shiver or shake. It's essential not to ignore these symptoms, as they can be an indication of a more serious underlying issue besides kidney stones. If you experience a fever that is 100.4 F, 38 C, or higher, along with chills, it's crucial to seek medical attention right away. Fever and chills can also be a sign of other serious health conditions, such as sepsis or pneumonia. Therefore, any fever accompanied by pain requires prompt medical evaluation. While a short-term increase in body temperature can aid in fighting off illness, a prolonged fever can be a sign of a severe condition that needs to be addressed immediately. So, if you experience a fever and chills along with other symptoms of kidney stones, it's crucial not to ignore them and seek medical care. If you are not drinking enough fluids, eating a diet high in meat, sodium, or sugar, or taking certain medications, you may be at a higher risk of developing kidney stones. Therefore, it's imperative to watch out for the symptoms discussed in this video and seek medical help if you experience any of them. Don't ignore them, thinking they will go away on their own. Kidney stones can lead to severe complications and even become life-threatening if left untreated. So, be aware of your body and any changes you may notice in your urinary tract or overall health to ensure timely diagnosis and treatment. Also, one thing that I want to specify is that the information provided in this video is collated from various sources like urologyhealth.org, kidney.org, and healthline.com and is just for educational purposes. It's always best to consult a healthcare professional for personalized advice and treatment. We hope this video has helped you better understand the symptoms of kidney stones. If you found it informative, please don't forget to hit the like button and subscribe to our channel for more such videos.